Hi, I'm Judy, one of the nurses who works in this unit. I'm here to give you a suppository to help you open your bowels. A suppository is a bullet-shaped pellet that contains medication that can be absorbed in your rectum. Do I have your consent to go ahead?
Yes. Sure.
Before we start, I'm going to draw the curtains around your bed now to ensure you have privacy and also cover you with a blanket. I'll make sure that there's a bedpan or commode close that you can use. The toilet is next door as well, if you'd prefer.
Thank you.
I'll put on a disposable plastic apron and non-sterile gloves before I start. Right. Can you please lie on your left side with your knees bent towards your chest? Lying on your left side follows the anatomy of the colon and makes it easier for the suppository to enter the rectum.
Okay.
I'd like you to try to keep your feet level and keep your buttocks close to the edge of the bed, if you can. I'm going to put a disposable incontinence pad under your hips and buttocks now. Sometimes there is a little bit of leakage as the suppository melts in your body.
Okay, I understand. What's next?
The next step is to do a patient ID check, so I'll check your name and date of birth with you and then check the information against your ID wristband. I'll also check your allergy status. Then I'll check your drug chart to confirm that you've been prescribed the suppository correctly.
I see. Once you've checked that everything is correct, what will you do?
Before I insert the suppository, I'll check your anal area for excoriation. That's redness and soreness. I'll also check for any infestation with pinworms, for example. Another thing I'll do is to see if you have hemorrhoids or a rectal prolapse. If I notice any problems, I'll report them to the doctor so they can be treated.
Okay.
Next I'll put some lubricating jelly on a gauze square to make the suppository easier to insert. Then I'll gently separate your buttocks and put in the suppository. It will go in about the same length as my index finger. I understand that it's not pleasant, but if you can try to relax as much as possible, it's easier for the suppository to go in. Once the suppository is in your rectum, I'll need to clean any excess lubricating jelly from your perianal area. That should feel more comfortable for you.
Right. How long do I have to stay like this?
You should remain lying down and keep the suppository inside the rectum for about 20 minutes, so the medication can work effectively. You might have some discharge from your rectum as the suppository melts. This is quite normal. I'll put the call buzzer in easy reach next to you on the bed. Please call me if you need some assistance when you're ready to use the bedpan or go to the toilet.